1,794 doctors in Tanzania are unemployed, a situation that the Tanzanian Medical Association says is constraining service provision in the country's health sector. And so the much talked about proposal to hire doctors from Tanzania was deemed far-fetched, as the country is not sufficiently equipped with personnel to lose out to Kenya.
Uhaba mkubwa sana wa madaktari. Uhaba huu serikali inaijua ya Tanzania, na serikali ipo kwenye mpango, kwa maelezo tuliopewa, ipo kwenye mpango wa kuajiri hata madaktari wale 1794 tulionao ambao hawajaajiriwa.
But Tanzanian President John Pombe Magufuli, after meeting with Health CS Cleopa Mailu, now says 500 doctors from the pool of unemployed medics will be forwarded to Kenya.
Na bahati nzuri wenzetu wamekubali kwamba watalipa kwa mishahara mizuri, kwa terms za dola, watawapa accommodation pamoja na security.
The outsourcing was intended to replace striking doctors, but that has since changed, with the strike called off days ago.
Nia na sababu ni kwamba tuko na vituo vingi vya serikali ambao zinahitaji madaktari, na ingawaji tuko na madaktari katika nchi yetu, hivi karibuni tulikuwa na mgomo wa madaktari, na sindikizo moja walikuwa wanasema ni kwamba hawako wa kutosha wa kuhudumia watu, kwa hivyo wanafanya kazi kwa masaa mengi kukuja kuona wale wagonjwa.
The irony, however, is there are 1,400 unemployed medics in Kenya. KMPDU in a statement argues, quote, "It would be very costly and therefore a show of imprudent public finance management to have 500 Tanzanian doctors at more than 20,000 shillings per day per doctor in logistics of housing and transport, and still incur recurrent costs of salary at the rates when counties have been rejecting Kenyan doctors, sometimes on the basis of budget restriction and tribe."
Kazi hipo na tutaendelea kutafuta madaktari wengine, na tutaendelea kuzungumza na serikali kama watatupatia wengine zaidi wa kuendelea kukuza ile huduma tunapatiana Kenya.
The debate on registration of foreign doctors would persist when, on the one hand, the government plans to take the mandate away from the KMPD board and back to the health ministry. On the other hand, KMPDU argues, as the law stands, they will have to undergo procedures which includes examination by the medical board. That would take not less than 3 months unless that regulation is disregarded.
All we need is for the procedures of registration of those doctors to be finalized. If there is any amendments that are required to give the government the teeth, the legal mandate to register these doctors, it's also sorted out soonest, and then we start getting doctors.
Vigezo vikubwa ambayo tutaviangalia, kwanza lazima awe amemaliza mafunzo ya vitendo, internship. Lakini pili, lazima awe amesajiliwa na baraza la madaktari la Tanganyika.
This comes even as the impasse between doctors working at KNH and the institution was resolved, as the KMPDU and Kenyatta National Hospital signed a return to work formula today.
We have agreed, and the documents have been signed, a return to work agreement, and therefore we advise all our members to resume work immediately because the strike that affected Kenyatta National Hospital is forthwith off.
Despite the challenges that we had, I think we've been able to agree on the middle ground, and we are now able to say that we have reconciled and we are going to be a happy team again. Thank you.
Jackie Maribe, Citizen Weekend.